Good day, everyone. My name is Grace Ogala, and I bring you good news from Amazing Grace Health Center. The topic of our discussion today is helpful tips to decrease the risk of eye disease related to diabetes. Okay, this is a very important topic, and I want you to pay very close attention. Okay, diabetes destroys the eyes. Okay, if the blood sugar is uncontrolled. Okay, okay, elevated blood glucose can cause changes in the fluid levels and cause swelling in the tissues of the eyes that help us to focus. So it is so important to keep your blood sugar within normal range, because if there are changes in the fluid levels in the blood vessels, you can have a blurry vision, okay, and that is not good. Okay, and if this elevated blood sugar remains for a very long time, it could cause problems. These blood vessels can be destroyed, okay? And that is why you need to let your doctor know when you start having this kind of symptom. And so your blood sugar can be checked and monitored by your doctor, and medications can be adjusted, and your doctor can even refer you to the diabetic educator or to the dietitian, especially if you don't know the right food to eat. Or, your doctor is very brilliant, and based on the assessment, the doctor will send you to where you should be. And I just want to advise you that you should please take all your medications as prescribed, exercise regularly, maintain healthy weight, eat healthy, have a good stress management strategy in place, okay? Don't be so worried all the time. And also sleep adequately, okay? And try your best, and your blood sugar will be well controlled, okay? All right, let's go further. Okay, the American Diabetic Association recommend that people with type 2 diabetes should have an eye exam when they are diagnosed of diabetes. Okay, and also people with type 1 diabetes, they can have their first eye exam within 5 years of being diagnosed. Okay, and when the ophthalmologist check your eyes, they may discover some eye disease if your blood sugar is not well controlled. I really pray that they will not find out any eye disease in Jesus' name. But again, you have to do the right thing now, so that way your blood sugar does not become uncontrolled and lead to all these eye diseases. And some of these eye diseases that are commonly seen when eye exam is done are diabetic retinopathy, cataracts, macular edema, glaucoma, and dry eyes. Okay, let's explain these eye diseases in detail. The diabetic retinopathy is caused by damage to the blood vessels in the tissues at the back of the eye. That means when the retina is damaged, they say the person has diabetic retinopathy, and poorly controlled blood sugar is number one risk factor. Okay, and some of the symptoms are blurred vision, dark spots, flashes of light, seeing an increased number of floaters, and poor night vision. Okay, when you start having all these symptoms, you need to let your doctor know, so your doctor can refer you to the ophthalmologist to have your eyes checked. Okay, because this type of eye disease can cause blindness. All right, if prompt treatment is not received. Okay, if it's a mild case, your doctor can just adjust your medication and tell you to eat healthy. But in advanced cases, laser treatment or surgery can be done, okay, to correct this problem. Another disease that is common among diabetics, that can happen to people with uncontrolled diabetes, is cataracts. And diabetes is a common risk factor, okay? And sometimes the person may have a cloudiness of the lens, and you just feel as if there is cloud in your eyes. I pray that this will not happen to you in Jesus' name, okay? Also, it can lead to vision loss if prompt treatment is not received, okay? And the person can even view colors as dull. Okay, this condition is very treatable by surgery to restore the eyes back. Okay, but the whole thing is prompt treatment. All right, and this is why you need to report any acute symptom to your doctor, and this is why you need to have at least yearly eye exam. So that the doctor can discover any new eye problem in a timely manner. Also, another disease is macular edema. It's a type of eye condition where there is swelling and fluid buildup in the macula of the eye, the central part of the light-sensitive retina. It often coincides with the retinopathy that was described earlier on, and this can also cause severe vision loss. Okay, that's not very good. I pray that we will not have this condition in Jesus' name. Also, glaucoma is an eye condition in which there is increased fluid pressure in the eyes that can result in damage to the optic nerve and causing blindness if untreated. Okay, with glaucoma, that means there is increased fluid pressure in the eyes. Okay, if this happens, it can lead to the disruption of the optic nerve, and that's not good. It can cause blindness. So a stitch in time saves nine. So make sure you let your doctor know, and so you can go to the ophthalmologist for proper treatment. Okay. Also, dry eyes is also common among people with uncontrolled diabetes, who have this elevated blood sugar, and it causes blurred vision, and which improves with blinking. And sometimes they have excessive watering to compensate for the dryness. Severe stinging and burning of the eyes can be reported as well. This is not very good, and this is why you need to let your doctor know, so a doctor can do necessary referral and send you to the ophthalmologist, like I mentioned earlier. Okay, and also eye care among pregnant women. Pregnant women also have a problem with this eye damage can happen. So it's very important that the pregnant woman should see the eye doctor also. Okay, the OBGYN knows how to take care of the pregnant woman, so we will leave it at that. Okay, my advice here is that pregnant women, do not neglect your eyes, please. Very important that you see the eye doctor. Okay, so I have some good advice for Ross. So this discussion is not just for me alone, it's for everybody. Okay, it's not even only for people with diabetes. Everyone can benefit from it. All right, the best way to decrease the risk of eye disease that is related to diabetes is as follows. Okay, make sure you keep your blood sugar less than 200. Okay, very important. Or A1C below 7, as advised by your doctor. Also, keep your blood sugar in the range of 80 to 130 before you eat food, and less than 180 2 hours after you eat. Very, very important. Okay, also keep your blood pressure within normal limits, less than 130/80, and also your cholesterol should be kept within normal limits as well. Okay, the bad cholesterol should be less than 70. That's the LDL. The triglycerides should be less than 150, and the total cholesterol should be less than 200. Okay, this is very important for you to maintain good vision. Okay, And also smoking cessation. Almost in every discussion, I always emphasize smoking cessation. Smoking is not good for the eyes either. Please, if you are smoking, let your doctor know. And your doctor will advise you on the best thing to do. You can also call the 1-800-QUIT line. They are very nice. I've heard so many good things about them. Okay. Also, your doctor can prescribe you some medications that will help you with smoking cessation. You can even get nicotine patch, nicotine gums. All of those will help you. The word of the wise here is please stop smoking. It's not good for you. Also, I talked about having the eye exam before. It's very important that you have an eye exam, okay, to decrease your risk of eye diseases. I believe in the principle of a stitch in time saves nine. So when you go for the yearly eye exam, it will enable the ophthalmologist to discover any new problem with your eyes, okay? Like I just had one last year, and I'm scheduled to have another eye exam next year, okay? Very important. And when you go for this eye exam, make sure you take somebody with you, because after you finish the eye exam, your eyes could be blurry. I learned my lesson the hard way. I could not drive for almost an hour after my eye exam. I was in my car and I couldn't go anywhere because I could not see. So it is very important that you take somebody with you to drive you home, okay? And avoid driving for at least an hour or two, please, okay? And also, another advice is contact your doctor or ophthalmologist if you have any symptoms with your eyes, like if you just notice you cannot see in the night anymore, you have floaters, burning, stinging eyes, let your ophthalmologist know so they can do a quick exam. Don't say, oh, it's not 1 year yet. If I don't wait till 1 year, insurance will not pay. Don't ever think like that, please. If you don't feel right, let your primary care doctor know, and they will send a referral to the ophthalmologist. You can even call the ophthalmologist. There are some very good ones, like my doctor. Hey, he does not even need referral from the primary care doctor. When I pick up the phone, I say, hey, I need to see you. They just put me on schedule. So what I'm trying to say here is that make sure you go and see the doctor when you have eye problem. Please don't wait, because it could be something very serious. Okay. Also, people with eye problem, they should be very, very careful so they don't have episode of fall, like, because if somebody don't see very clearly, they are at risk for falls, especially the elderly people. Okay, so if you have an elderly parent, always check on them. Make sure they have extra help in the house, okay? All right? Just ensure safety with people that do not see clearly, okay? And also, if you have a prescription eyeglass, make sure you wear your eyeglass all the time. You see, I have mine on. Okay, so always wear your eyeglasses. And also, do not forget to take your multivitamin. There's a multivitamin that is very good, the Ocuvite vitamin. It has all the essential eye vitamin and the minerals. It contains zinc, vitamin C, E, omega-3, lutein, zeaxanthin. It's very good for the eyes, okay? So make sure you have the multivitamin for the eyes. Very, very important. Okay. Also, they always recommend vitamin A for people that, they are at risk for eye diseases. And carrots and sweet potato are good sources of vitamin A. Also, cantaloupe and apricots are also good sources of vitamin A. And also, vitamin C is very good. It's a very good antioxidant. It helps to protect the eyes, protect the body. Okay, so it's very important that you take vitamin C, especially if you don't have access to purchase this Ocuvite, the multivitamin. You can just take vitamin C or take the vitamin A. Very important. And you know that the food sources of vitamin C are mostly fruits such as peaches, lemon, even the red bell peppers, tomatoes, strawberries, okay, grapefruits, even tangerines and oranges. they all have vitamin C. And you can also take the over-the-counter vitamin C as well. Also, vitamin E is very good for the eyes, okay? It helps to keep the cells healthy, okay? Food sources of vitamin E are avocados, almonds, and sunflower seeds. And also the cold water fish like with omega-3 fatty acids can also protect the eyes, okay, from dry eyes. Okay, so if somebody suffer from dry eyes, it's important that you take the omega-3 fatty acid. Some food sources of this omega-3 are salmon, tuna, sardines, even trout fish. Okay, so all of this will help you with the dry eyes. Okay, and also leafy green vegetables. They are very rich in lutein and zeaxanthin. Such leafy vegetables that are good for the eyes are things like kale leaf, spinach. They are very good for the eyes, okay? Even turnip is good, collard is good, lettuce is good, broccoli, peels, they are all very good for the eyes. Even eggs, eating egg is good for the eyes as well, okay? And also beans is very good for the eyes. Legumes, it's a rich source of zinc, and you know zinc help to keep the retina very healthy, okay? That, you know, the retina we talked about before. If you eat beans, it will help to keep that healthy, okay? And also, you know, let me just list some examples of beans for you. You know, the black-eyed beans is good, the kidney beans is good, lima beans is good, you know, and also some other foods that give you a lot of zinc in the body. Oysters, the lean red meats, chicken, turkey, and even fortified cereals are rich in zinc. Okay, so like I always say, eat healthy to stay healthy. Okay, eat healthy to keep your eyes healthy, and avoid fried foods. Avoid smoking cigarette, tobacco product, like I mentioned before, and also don't expose your eyes to the sun rays. Because that's not good, can damage your eyes, okay? And food for thought, vitamin C can also help you to repair and grow new tissue cells, okay? A word is enough for the wise, okay? So I really want us to take good care of our eyes, okay? Because the eye is the lamp of the body. If you don't have good eyes, you cannot see, and it's not the best. So try your best. Manage your blood sugar very well. Keep your blood sugar within healthy ranges. Please exercise at least 30 minutes a day. Eat very healthy, and lose at least 7 to 10% of your body weight or more. Please manage your stress very well so your blood sugar will not be elevated, okay? And sleep adequately, drink water, okay? And always go to your doctor's appointments and take all the medication prescribed. We are healed spiritually and physically. We will not have eye diseases in Jesus' name. All right, follow me on all social media outlets. Subscribe to my my YouTube channel. Even also follow me on TikTok. Follow me on Facebook and anywhere you see my name. Until we meet again, it's goodbye for now. God bless you and happy Thanksgiving in advance.